Good afternoon. I am Dr. Gurpreet Wander from Dayanand Medical College and Hospital, Ludhiana, and I have the pleasure of introducing to you Dr. Jayagopal, who is Director of Interventional Cardiology in Lakshmi Hospital, Palakkad in Kerala. Dr. Jayagopal is a senior interventional cardiologist with special interest in heart failure, and we were just talking on heart failure some time back, and now we are going to speak to Dr. Jayagopal about the Indian Heart Failure Registry. In fact, we just spoke about the Asian Heart Failure Registry just now, and we did speak about the Inter-CHF study and the Trivandrum Heart Failure Registry, which are the other two registries from our country. So a couple of years back, people used to believe that we don't have enough heart failure data, and Dr. Jayagopal is going to add significantly in terms of the pattern of congestive heart failure. So Dr. Jayagopal, what kind of patients are you including in this registry, and what is your ultimate aim? What numbers do you want to achieve, and where are we at this moment? Indian physicians would be very keen to know about this registry.
Yeah, Dr. Wander, it's indeed a pleasure to be here and then to be part of this interactive session, I would say. We actually, we were all impressed with the Trivandrum Heart Failure Registry. And then, over the last few years, the acute coronary syndrome, at least apart from where I come from, Kerala, we see a lot of heart failure admissions, and that's been our major hospitalized patients, acute care. So from that perspective, we started looking into what we could do to the rest of the country. And then at that point of time, we realized that we have indeed a paucity of data in acute decompensated heart failure. So that's my focus as of now. So we are actually looking at the demographics, clinical patterns of presentation, and then also to look at the practice patterns, and then to see pan-India how this would look at. So I know this is a very ambitious project. It has never been attempted all over the country so far. But then the Indian College of Cardiology gave me a mandate to go ahead with this program, and we started with a South Indian pilot study, which actually commenced on the 1st of August 2018. And then I must confess that it's run a remarkable, much more than my expectations. We started with about 10 centers in South India, and then now this is from the 1st of November. This is sort of extended to the rest of the country. So still, the centers are getting enrolled. We are actually taking it forward. The plan is to have at least about 10,000 patients enrolled, so that we have some meaningful data on the current situation in the country.
What are the inclusion criteria for this? What kind of patients are you including in this?
This is, as I had mentioned earlier, this is just acute decompensated heart failure. We are just looking at acute admissions, anybody above the age of 18 years, and then who would qualify to, basically it's a kind of a clinical scenario where somebody comes with an acute onset breathlessness and you make a clinical diagnosis of acute heart failure. And then the contraindication would be somebody who's not consented to be part of this. So we have an ethics committee which is looking into the approval part of it, and then who consented, they would immediately get enrolled. And then we would want a consecutive patient enrollment. That's very important. Otherwise, it would not really make a meaningful...
To eliminate the bias you want.
Yes, to eliminate the bias as far as possible.
Is there a time frame for which...
Yes, this is actually a prospective registry which would look into 1 year data. So what we are looking at is a in-hospital patterns, look at the 30-day rehospitalization mortality, and the primary outcome is be again at the end of 1 year to look at the same sort of a pattern. We may not be able to do a clinical follow-up on all these patients. Maybe it's a telephonic follow-up at the end of 30 days and 1 year. So it's all clearly laid out, and then we are actually looking at a 1 year follow-up.
Do you think heart failure in India is increasing? What are your thoughts on heart failure patients who are admitted and heart failure that come to the clinic? What is the prevalence in India, and is it increasing? Is it static as compared to the West? Where do we stand?
No, I definitely feel it's increasing. That's indeed the reason why I come out with this proposal. At least in the part of the part of the country where I am from, we find an aging population. That's one of the major, as all of us are aware of, that's one of the major things. And again, second important thing is hypertension prevalence is definitely rising. Though our statistics say from the age of 30 years, you look into we have a lot of data to back it up. 30% of our patients or more, if not more, are hypertensive. And as the aging population goes on, this becomes even more increasing. Chronic kidney disease is again another problem, and our ACS patients are doing well. You would have seen our data, the Kerala ACS and the PAMIST, this thing which is just coming out. So though a lot of lives are saved with acute myocardial infarction, but then this all becomes later on heart failure sort of a. So I think the prevalence is rising. This is going to be a major problem. My own feeling is that in 10 years from now, you will perhaps have more heart failure patients, focusing only on heart failure. And I am sure this subspecialty will grow in a very big way.
And what do you think is the best treatment for patients who are admitted to hospitals? What treatment guidelines do you feel as an Indian physician, since you are an interventionist with interest in heart failure? What would be the best protocols for management of such patients? I know it's a very wide spectrum.
Very wide spectrum.
And it's not easy to answer this question, but still, you being an expert who simplifies things, and I heard your talk in the morning also. So what do you think is the best treatment for physicians?
Well, I think obviously it would all start with prevention. You know, the moment you get in an acute decompensated heart failure patient, it's a sort of an emergency. But I think in emergency situations, we heard people how early you need to give the diuretics, and then I think the focus is basically stabilization of the patient. And I think the key thing there would be an antihypertensive medication, because that's the key thing. And a good percentage of our patients are actually rehospitalization. So one of the major challenges that we thought was when they go from the hospital. So we were looking at our own initial data, we find that rehospitalization is indeed a major problem. That's because we really do not have a protocol in terms of the guideline-based therapy for heart failure. And if you have a quality program running where you sort of have a checklist where when the patient gets discharged on this medication, I'm sure there is definitely a element of prevention to that. But I think in terms of therapy, it's basically to look into the standard guideline-based therapy. You would need to put them on the standard antihypertensives, ACE inhibitors, ARBs. We were looking at our own data. In fact, we found that the ACE inhibitor prescription or the ARB is tremendously on the lower side. Beta blockers, it's more than 50%. Unlike the registries even in the so-called Western registries which you have seen, all patients on all the guideline medications are less than 1%. But then I think there's still a role for tailoring these patients to the guideline-based therapy, and then I think that's a way perhaps medical treatment has a huge role to play in the treatment as well as the prevention of heart failure admissions.
Why do you think patients get readmitted so frequently in heart failure? Because this is an issue world over. And do you think fault lies with the physicians or the patients or both? And what best? Is it related to the lack of patient education, drug compliance? What are the factors? Because this is really the issue. I believe in US now, most insurance companies don't even reimburse for readmissions for heart failure. And in fact, we were participating in the Asian heart failure trial, and somehow the patients were not, the readmission rate was not that high as it was anticipated. And some of the experts felt that our patients have higher thresholds for admissions. So what are your thoughts on some of the readmission of heart failure patients is a big issue which bothers physicians?
I think it's an excellent question. In fact, the main idea of starting this registry was we were looking at what we could do for the patients at large in terms of preventing them from getting readmitted. I think the major problem, as you had rightly pointed out, what we thought was that physicians are not spending sufficient time with heart failure patients. If in an acute coronary syndrome, just compare our scenario. Somebody comes with an acute coronary syndrome. I'm sure the entire focus is towards that patient. Somebody comes with an acute heart failure. He would get a Lasix or whatever the diuretics are. Somebody would say, you stabilize the patient, we'll see that later. I think there is a bias right from there itself. Secondly, I think, I'm fairly certain that the physician does not spend sufficient time in terms of education. I must also confess that I'm part of another registry, another study we just completed. There were about 8 centers in Kerala. I cannot divulge the entire information because it's just being analyzed, the data is being analyzed. So what we found that what we found was that the reason why there were a lot of rehospitalization admission was because patients were not continuing therapy. So simple measures like checking your weight at home, checking whether you are on guideline-based medications at the time of discharge, and a phone call and follow up with by the physician or let's say the physician assistant, that would do a huge sort of a preventive approach. I am sure this will go a long way in terms of, my personal feeling is lack of the education, patient education, physician awareness, and also the interaction, which perhaps is something which can easily be tackled without much expenditure.
Those are really words of wisdom which I think an Indian physician can learn from the vast experience that Dr. Jayagopal has. I think we've had some very useful discussion on this upcoming Indian registry which you are heading, and some of your thoughts on heart failure. Can I just ask you, how do you find this meeting, this conference? Is it different from previous conferences? Has it been a satisfying experience for you? And how have the last couple of days been at this?
Yeah, it's been really amazing. The moment I walked in here, it was nice to see a kind of an ambience which we generally get to see in the Western countries. And I think I must really congratulate Dr. Prapul and the team. The other thing was that the ease of going into the halls. It's all so beautifully done, and then so we hardly had any hassles, and it's been a very good experience. A lot of key speakers, good talks, and even the exhibits, everything has been done up so well. I think it's been a fantastic time that we had in Mumbai. We hope in the coming years also we'll have something like this or even better than for us to show to the Western world that we are also reaching the kind of mark that they are looking at.
Thank you, Dr. Jayagopal, and these words of appreciation coming from such a senior Indian cardiologist. I think the Bombay team can be proud of what efforts they have taken to make this conference a success. It's been a pleasure talking to you, Dr. Jayagopal.
It's been my pleasure as well.
And wish you all the best.
Thank you so much,
Thank you. Pleasure.
And